I'm Kritika Saxena. I function as a lead to psychological services here at Sukoon Health. For over 10 years now as a psychologist, and I've been associated with Sukoon for over 3 years now. Our day at Sukoon is quite hustling and bustling with a lot of activities going on. We have OPD sessions, our outpatient clients coming in seeing us for therapy sessions. We also have an acute psychiatric setup where we have clients who are admitted here. So we have IPD sessions for them. The team has clinical supervision for everyone. Then there is also peer supervision or peer review which is happening. MDT discussions. An MDT is a multidisciplinary team where you have a psychiatrist, where you have a clinical psychologist, a counseling psychologist, an art-based therapist, a psychiatric nurse. And all of us take out our valuable time once a day to sit down and really discuss the clients that we are seeing on a day-to-day basis. A practice that we like to repeat on a weekly basis with a bigger team where there's one case scenario in question and we are specifically talking about that and how do we want to plan our intervention for the same. So when a client walks in, it's very important to hear them and address their concerns. Apart from conducting a clinical interview, we like to do something which is called a psychometric assessment, which is a little more subjective because that's what you hand over to the client and they are able to fill that out. We are able to reach to a diagnosis which helps us understand their concerns better. Because, like I said, that not everything can be expressed verbally. Basis the significant findings that we have on the assessments, we're then able to plan an intervention which is both pharmacological, which is medication, and psychological, which is therapeutic intervention. All of you would have heard of terms such as CBT, as DBT, which are different techniques for individual therapy. A different part of this is also family intervention, which is targeted by a psychiatric social worker. We as mental health professionals have the responsibility to psychoeducate the family members, which is about providing relevant information about the illness, about the disorder, the concerns that the client is going through, the symptoms, what the treatment has been planned, and the intervention. This helps the family in understanding the challenges that the client is facing and promotes growth, support, and a better recovery for the client. Our psychologists also take it as a responsibility of doing a feedback call. We encourage families to come and visit the clients here. We have open family visiting hours. When a client walks in for their first therapy session, we need to understand that they're coming up to us with a lot of questions that they're coming with, whether this is going to be confidential. Other than the purely empathetic angle, of course, there is the whole legal, ethical code of conduct that every mental health professional is bound with, and one of them is confidentiality. In such scenarios, what helps is developing a good therapeutic bond or what we call a rapport with the client. Once they feel that they're able to trust you, they would be able to open up more and also more receptive to what you have to offer them in terms of advice, suggestions, or an understanding of the illness, setting goals together, working upon those problems, looking up the future intervention plans. So what we call as rolling with resistance. It might take a couple of sessions with the client for them to really understand what's happening with them and to feel that yes, there is recovery. My message to everyone, every individual who's looking for mental health care is that you matter. your mental health matters. Help is available to those who are looking to understand themselves better, to work upon their patterns of thinking, to process their emotions, to looking at modifying their behavior, becoming better individuals. Help is available at Sukoon. Book that appointment. Go for your first therapy session.